This will be a fairly brief update unless you have a lot of questions for me. We met yesterday and presented to the Central East LHIN an overview of the preferred integration plan, or should I say the Central East LHIN board. We had submitted the detailed document, which is on the Leading for Patients website, about a week ago. Robert Byron and I went through the document, did the presentation, answered 3 questions I think they had for us, which were relatively straightforward questions. So the LHIN then put up a motion that had been pre-prepared. Essentially what they have done is they have approved funding of the costs we've incurred so far in terms of due diligence, and they've approved another $2.5 million worth of funding for further due diligence. They have also recommended that we go through start the formal process to start capital planning for both this facility and the Scarborough facilities. So we are now in the process of developing what's called a pre-capital submission, which is the precursor to putting something in front of Cabinet to start a planning process. Because if you remember from the November 13th meeting, one of our conditions was that we get capital grants to start planning for expansion of this facility and looking at what we need to do in terms of the Scarborough facilities. So this is the first step towards that, and frankly I take this as good news that they've actually put this in their motion, because I think it really does mean that they're quite serious about it. The other thing we did do in the presentation to the LHIN yesterday was clarify what we see as the timetable going forward. And so we are targeting to complete due diligence and have the appropriate documentation gathered and prepared to submit to the LHIN board or for review by the LHIN board on February the 26th, which is the February board meeting. That will then give the LHIN the opportunity to decide whether they wish to approve the merger of the 2 corporations. If they do that, then they will hand the documentation along with their recommendation over to the minister, and the minister has 20 to 30 days to decide whether she will approve it, because at the end of the day she has to be the final approver of this. Assuming that approval is forthcoming, we are targeting to be a merged corporation effective April the 1st. So the timetable is built around achieving that. So that's going to put a lot of pressure on a lot of people in terms of pulling data and information together. We have to produce an amalgamation agreement. We have to decide on the composition of the new board and how it's selected. We have to develop corporate and medical staff bylaws, etc. So we're going to be pretty busy for the next 3 to 4 months. So we'll keep you updated as things move along. But that's where we're at. So I'll open it up for questions.
One of the questions that came up at our town hall here that David managed for us was about the board and representation on the board at the Ajax facility. And I'm not sure how that works, but is there an assurance that we will be equally represented? And I'm not sure what you base it on in this sector. But
so a couple of things. It's a good question. So the question was, how will board representation be structured? So first of all, it's important to understand that we do not have in the hospital sector representative boards. Boards are not designed in the hospital sector to be representative. They are what's called a skills-based board. We select board members based on the skills they bring to the table, not where they live. However, having said that, we have had a practice, certainly at Rouge in the past, of having, drawing those skills-based board members from the communities we serve. And we anticipate, as we go through the next few months, that we will build in some form of process as part of the bylaws of the proposed new corporation that will have some method for doing something similar, so that each of the communities feels that they have appropriate representation on the board.
Thank you.
Any questions at RVC?
We opened it up here, but it doesn't look like we do.
Okay.
Rick, has the 60-day period officially started?
No. So another good question. So the way this works from a legislative point of view, there are two time periods. There are actually two 60-day time periods that come into play. The first is a 60-day time period under the Local Health System Integration Act, and then there's another 60-day time period under the Public Hospitals Act. We are working with the LHIN and the ministry to make sure that those two time periods are in alignment. Basically, the LHIN board meeting on February the 26th will be the end of the Local Health System Integration Act time period. And what we will have prepared by then is all of the documentation that will satisfy the minister's requirements under the Public Hospitals Act. So the LHIN board will have everything that the minister wants, or the ministry requires, by February the 26th. And then they will make their recommendation, assuming it's a positive recommendation. All that documentation goes to the ministry, and the Public Hospitals Act 60-day period, the back half of that is the minister's time to consider the decision. So that's the time period. We will issue the formal notification. I think it's December the 27th, I think is the date.
Follow up to that. At the last town hall, there was reference made to the general membership.
There will be a special meeting of the members of the corporation, which will be held on, I think, by memory, February the 18th.
So it's within that LHIN first 60 days?
It's within that first 60 days.
Thank you.
Maybe remind everyone who members of the corporation are.
So members of the Rouge Valley Hospital Corporation are the board of directors, the volunteers of the organization, members of the auxiliary, and any individual who has donated $20 in the previous year to March 31st. So the members for this year are people who donated in the year to March 31st, 2013. And it's $100. The other members are corporations that donated $100. So those are the members. We have about 7,000 or 8,000 members of the corporation. And we don't expect them all to show up. And the quorum for a special members meeting is, I think, it's 15 people. 15 members. Any other questions? Okay. Thanks for coming, folks. We'll keep you informed.